I'm Tina Trenner, Larry Harrison, and Pat Casella, and we're talking about the thing that Obama did to us, the abomination from Abomination, the health insurance policy.
The abomination, I like that.
What's from Obama? This is just it's just so bad. So now we're hearing that the CBO came out today and said, oh, this is well over $1 trillion. You know, they just didn't tell us everything, and so they couldn't figure out exactly how much this was going to cost, and they kind of hid things, and they didn't really talk about things, and now guess what? It's well over $1 trillion and going up. Okay, so now you said that they offered Nevada
$61 million.
$61 million, and we won't take it because?
It's not enough money. It's designed to fail.
But there's strings attached.
Well,
there has to be.
No. Actually, the string, if they put that in place, if we would have supported it, and we sat down with the governor and said, listen, this is not something you can handle. Initially, they came out with and said that this program would be designed to cover 2,500 people. Well, if you think about the average insurance policy as a $2 million lifetime benefit, and that's for people, that's for the average person.
Wait, stop, say that again?
The average person purchases a policy, they have a $2 million lifetime benefit.
Okay.
And that's the average person that, you know, if you take the whole, he's part of the 96% that's healthy that may never hit any major claims.
If you're ever sick enough to use up $2 million, you are in
but in this particular case, they're expecting that $61 million to cover 2,500 people that are sick, that are very sick. So let's just say that they use up $300,000 each.
Right.
That's $75 million, I believe, right? Or $750 million. It's not today. The number may not be right, but so the $61 million is totally underfunded.
It doesn't pencil out.
And then we figured it would probably be 50,000 people, not 2,500.
Right. And so there's enough money there to fund this thing for maybe 18 months.
Okay, so
maybe.
back to my questions. What strings are attached?
Well, we let the federal government, we suggested to the governor that let the federal government handle it, let them put together programs, because the funding of this will be, they're going to give you a set premium, a standard rate, saying, hey, you know what, you're sick, don't worry about it, you'll just pay us $350 a month and you get full coverage, no pre-existing, we'll cover everything, provided you haven't had covered for 6 months. And oh, by the way, if you're one of those people out there that have been paying through the nose and you have COBRA and you exhaust COBRA, you don't qualify. You have to be uninsured for 6 months in order to qualify for this plan. And the people that usually take COBRA are very sick. So if you're very sick, you exhaust COBRA, hold your breath for 6 months, then you can get on this plan. The thing that's amazing is that when the federal government's going to take it under control, they're going to handle it, because Governor Gibbons realizes that if he took it under control and it failed, it would only make him look even worse.
Yeah. Of course. I mean, why would the states want to pick up, why would any state want to pick this up, especially considering the financial problems that every state in the union is having right now?
Well, some of the states already have a pool established.
And Larry,
so they have a mechanism. They have somebody, they have a network of doctors and hospitals. They have somebody that takes the money in.
Right.
They have somebody that adjudicates the claims, and then they pay the money out.
Can I ask you a question, Larry? Let's talk about that. I want to throw this out at you, because you are, and this is no joke, he's the expert on a national level. If I have a high-risk pool in Georgia, and now the government's going to make us do another high-risk pool, wouldn't they consolidate it, make it all one pool?
No. For the states that have a high-risk pool, the premiums on those are high. Let's say they're $800 per person that's in there. But with the new plan, the abomination, we have where the premiums must have a standard rate. Well, nobody knows what the standard rate in Nevada is, but the starting pistol went off March 23rd, and it must be implemented by September 23rd. Yet we don't have a rating system. We don't know what the rates are going to have to be. Let's say that the rates are going to come in at $300 a head. So for the people that are in the high-risk pool now paying $800, they could drop it if they can go for 6 months without insurance and then be able to buy into the lower rated premium plan.
This is a mess. Okay? This is a mess.
There's going to be two different pay structures, premium structures, for an identical type of a program. One is going to be $800. The only way you can get into the new plan is if you, as Pat said, you don't have insurance for at least 6 months. So the feds gave the state of Nevada 90 days to come up with a rating system which is dictated by the feds, then find a network of doctors and hospitals that want to work for this reimbursement fee, hospitals and doctors, as well as somebody to take in the premiums, plan designs. You cannot get this done in 90 days.
And so what's going to happen to the states that don't do this?
The feds are going to be all together by September 23rd. It's mandated. It must be in place by September
1st for the high-risk pool.
No, I believe it's 90 days from the date from March.
Okay,
April, May,
that would be
June.
June.
Oh, July 1st?
I'm sorry, June 23rd. It's June 23rd.
So
June 23rd.
June 23rd, we're going to have a high-risk pool in the state of Nevada.
But how are we going to have it if the state will not do it?
Oh, no, the feds
Fed's
are
got
going
to
to
do
do
it.
it for us.
Yeah.
Now the feds have to do it.
But how about this? Larry's the responsible guy. He's been paying $800, $900 a month for 5 years, and I said, I'm going to gamble. I'll go down to UMC. Don't worry about a thing.
Yeah.
Come July 1st, I'm going to go buy that same plan. We're on the same age, and I'm going to pay $500 or $600 a month less with guaranteed issue. So I'm getting great insurance for affordability, and Larry, well, that's what he's getting.
GOTS. In Italian, you got GOTS. That's what you got.
I mean, that's exactly what it is. I mean, you want to talk about adverse, you want to talk about discriminatory and adverse. You have a guy who's responsible, and you have a guy that was irresponsible. I get rewarded, he gets punished. Only in America.
The National Association of Health Underwriters has been trying to get a high-risk pool in Nevada for years. We've been working in Arizona, in North Carolina, and other states as well to get a high-risk pool in place. And there's no other organization that's been trying to get a high-risk pool in the state of Nevada. So for those of you folks that are looking for health insurance, you're looking for a broker that has the knowledge of what's going on, be sure and ask if your broker is a member of the National Association of Health Underwriters. Nobody changes premiums by 1 penny. Nobody can give you a better price than going online. Be sure and ask if your broker is a member of the National Association of Health Underwriters.
Because you need a professional. Obviously, to get through this shark-infested water, you really need someone that knows what they're doing. I listen to these guys all the time and don't get it, all of it. So we try and bring the information to you, try and help educate you. I know you're sitting there going, we'll be right back.